So very often dogs will be quite tight in the TL junction. So that's the area where the rib cage ends and the lumbar spine begins. So similar as we did with the groin, I'm going to warm up the area. And also roll my hand across his spine. Now here it's really, really important not to put any pressure at all whatsoever. We're just mobilizing the skin, we're mobilizing the tissue just below the connective tissue, just below the skin. We're not putting any pressure on the muscle or on the spine. We're just rolling the tissue back and forth. And I'm going to go back to gently stroking the area. And here we're not going to traction the spine, but we are going to traction the muscles on either side of the spine. So I'm going to, you can put your hand basically as I have them now, one in front of the other, and start separating them. And you can see there's very, very, very little movement, but there is enough movement to gently traction the tissue, allowing for opening, release, and the fascia to let go. And then gently bringing our hands back together. So again, gentle traction. Again, I'm not on the spine, I'm just right off the spine. And once I'm done, I don't just lift my hands, I actually bring my hands back together. We don't want to stretch it and then snap the tissue back. We want it to stretch it and bring it back together, because there's a lot of benefit in this gentle crowding of the tissue. So it's not just the stretching, but then the coming back together and the release, but a controlled release. And again, we're going to warm up the tissue, check movement. You can tell there's a much nicer muscle tone under my fingers. There's a little bounce. And then depending on your dog's position, if they are lying on their sternum, you can work on both sides, and if they're just on one side, you can let them snooze, and then next time that you have the other side accessible, you can work on that side. Thank you, Stanley.